This recording is for the chapter on the risks of intrinsic brain tumor surgery and avoidance of complications by me and Dr. Ton. The main objectives are to review the risk profile of brain tumor surgery and the classification and avoidance of complications. This chapter starts with a short introduction highlighting that the comprehensive developments in the management of brain tumors mean that the impact of surgery must be critically assessed in terms of its oncologic benefit and associated risk profile. Common risk factors for microsurgical tumor resection do not differ from general cranial surgery and include age, clinical presentation, general condition and comorbidity of patients. We have to be aware that more aggressive resections, surgery in the elderly, and in recurrent disease carry an increased peri-procedural risk. In general, relevant treatment-associated complications lead to clinical deteriorations with significant reduction in quality of life and with potential consequences for the management of patients. In the first part of this chapter, we give some current definitions of complications. And we have to admit that there is no standardized definition of perioperative complications in brain tumor surgery available, with a high degree of subjectivity in the classification in the literature. In general, a complication refers to an adverse outcome that differs from the expected results of a surgical procedure. These complications can be regularly attributed to one of the three major causes, such as lack of information, incorrect judgment, and/or incorrect execution. We provide some current classification schemes of complications, such as according to the severity, and we mainly focus on the classification scheme which has been introduced first by Sevilla and colleagues in the late 90s with neurological complications such as motor and sensory deficits and aphasia, which may be caused by edema, structural and vascular injuries, and a hematoma. Then there is a second group of regional complications such as seizures and hydrocephalus, as well as superficial and deep-seated infections and the cerebrospinal fluid fistula. These complications may be associated with or without neurological deficits. And then there is a third group of systemic complications, most frequently the deep venous thrombosis and pulmonary embolism, but also the sepsis and the myocardial infarction. This latter classification scheme is discussed more in detail with respect to patient selection and avoidance of complications in the second part of this chapter. Overall rates of complications associated with brain tumor resections range from 2 to 25% in recent series, dependent on the definition, type of study, and referral base of institution. It becomes clear that more favorable overall outcomes are seen for centers and surgeons that perform higher volumes of brain tumor surgery. Our main goal of minimizing complications can only be achieved by a thorough understanding of the individual risk factors, all potential adverse events associated with the procedure, and a comprehensive peri-procedural plan as a basis for an optimized patient selection. This chapter particularly highlights the positive impact of modern technical developments on the risk profile and complication rates in brain tumor surgery. With this, we would like to end and hope that you will find this chapter informative. Thank you very much.